Hi, I'm Dr. David Barnett, and I'm a neurosurgeon in Dallas, Texas, with over 30 years of experience treating patients with spinal disorders. Today, I want to talk to you about the surgical treatment of cervical disc herniations. In a previous video on my website, I spoke to you about the diagnosis and initial treatment of cervical disc herniations. Today, I want to focus on the surgical options. It is critical to the patient's long-term success and well-being that they choose a surgeon who's conservative, well-trained, has common sense, good judgment, and is well-skilled with their surgical decisions. As far as surgery is concerned, there are several different options. The first point is trying to identify the exact disc that's causing the patient's symptoms. Sometimes there's one or two that are severe and are obvious. What we don't want to do is try to fix every single mild disc herniation involved, and there's a lot of decision-making skill in making that decision. Once you've established the location or the disc that's herniated causing the patient's symptoms, there are three separate options. All three have high degrees of success and can be performed with a very low rate of complications. The first one is for patients who have a healthy appearing disc and a disc herniation that's off to the side. A minimally invasive foraminotomy approach can be performed either through an anterior incision or an incision on the back of the neck. The disc is preserved and we're able to just simply remove the part of the disc that herniated. For patients who have a larger disc herniation or more central herniation, or the disc is degenerative, or there's even a focal deformity of the spinal column called kyphosis, then frequently the entire disc will need to be removed. This can still be performed through a small incision, but the disc will need to be replaced. There are two options in that situation. For well-selected patients, an artificial disc or artificial disc arthroplasty may be indicated, and for others, simply a spacer to replace the disc with a little titanium plate works well. It is not a one-size-fits-all decision. Regardless, if the patient's surgeon is well-skilled, they had a good operation, they should do well with a very high degree of success. If you've been told you need surgery and you live in the Dallas-Fort Worth area, we'd certainly be happy to see you for a second opinion. This is Dr. David Barnett, and I appreciate your time. Thank you.